very important point is to establish a sense of trust between you and your SP, just as you would establish that same trust with any patient in a clinical setting. So I'm going to make this statement. It's no pain, gain. And I'm saying that because usually you hear no pain, no gain. But no pain, gain is to remind you not to injure or hurt your SP. You could easily overdo a physical exam and end up really annoying them. And that's not good for you, because you have to remember that when you head into the hallway to write your note, the SP is grading the encounter. And that's a large majority of the points. So they are professional. They are trained. They know what to look for. So I'm going to give you a few hints, but I want you to carry it on. And for all of your physical exam maneuvers, you are trying to tread lightly. It's, like the easy listening jazz station where you tune in at 2 a.m. and they say, it'll be about another hour of Miles Davis, so sit back, relax, and enjoy. I'm going to call this easy physical exam. And you want to be as easy and gentle as you can be. Just remember that easy listening station doesn't bother anybody. It's jazz, it's soft, it's relaxing. And that's the way you're going to treat your SP. So let's remember, we don't need to elicit deep tendon reflexes with a reflex hammer going boom, boom. You're just going to tap once. They're going to know. They'll do it. They'll move. They'll kick. It's an SP, so they know what's going on. You don't want to break that applicator, and when you're doing discriminatory sensation on a neurological exam, you're not really going to be scratching anybody with anything sharp. No real scratching. If you want to lightly go over their skin with something that hasn't been broken, it doesn't have a jagged edge, okay. The other thing is when you're looking for costovertebral angle tenderness and you're doing that banging towards the back over here in this area just above both kidneys, and you do not want to really hit hard, so it's just a little tap, and they get it. You have to understand that this is their job, so not only will they be doing this sometimes twice in the same day, but they might be doing it all week for many weeks. And they're really going to lose patience with a candidate, with someone who is pounding on them in any way. So when you're looking in their ear, it's the gentlest use of the otoscope. Remember, what are you really looking for? You're just trying to show them you know how to look at the tympanic membrane. So you just want to softly touch it to their ear, right? When you're pushing up their nostrils to look in their nares, you're not going to shove their nose up like that. It's all gentle. I mean, this goes for patients in, real medical practice too, but even more so for the SP. You want to tread lightly, go gentle, and give them a sense that they can trust you. So when you're doing deeper pressure on the abdomen, don't go that deep. We always learn in medical school that you're going to first do some light pressure when you're palpating and then a little deeper. We don't need to push down that deep on this SP. They get the idea. They get the idea that you're on their abdomen, that you're doing the thing you're supposed to be doing. You're doing the right exam maneuver in the right place. So the key point I want to drive home is to go easy, easy listening, easy physical exam. Just relax, connect to the patient, and make sure they can trust your physical maneuvers. And the key thing is to remember, you're not there to push them or hurt them. Quite the opposite. You're there to give them that first-class experience. So if you're going to be lowering the exam table, you're going to want to support their back and say, hold on, don't lean back until I've lowered it. Okay, let me help you. Okay, if you're going to step down from the exam table, let me put this footstool here, and I'm going to make sure that you're comfortable. If you're doing a Romberg test and the person's eyes are closed, you're going to support them from either side. You don't want them falling over. If you ever ask them to ambulate, to get up off the exam table, you're right there spotting them. You're grabbing them a tissue if they're crying or if they're coughing. You're getting them a glass of water if they keep clearing their throat. You're there to take care of their every need and comfort, and you want to send that message to them at every possible moment. So remember, you want to be easy, gentle, create that sense of trust. And like I said, it's no pain, gain, your gain.